All right, so let's start talking about manual therapy for the shoulder and manual therapy in general. So, if we look at the research, we know that manual therapy in itself, the research is a little spotty side to side. So, if we look at the research for manual therapy, we know it's a little spotty. We know that the changes we can make are very short term, if any. So, the big thing with knowing that is that we have to then take that little bit that we know, take our clinical decision making, and decide what we need to do for our patient. So, I will say I use a lot of manual therapy, especially at the beginning of our treatments. These are something where you get to be hands on with your patient, you get to know them. I tell a lot of bad dad jokes, even though I'm not a dad, but it keeps them entertained and it helps us gain that trust. And it also gives me a hands-on feel of what that shoulder or what that elbow looks like and feels like. So I will use both joint mobilizations and soft tissue work to help get me a better idea of what they're feeling, but also help with getting some of that mobility and motion back and decreasing pain. Looking at the research, we know that our gains are very short-term and limited. So how a manual therapy treatment should always go is you're going to assess your tissue. You're going to look to see what range of motion am I looking to improve, or what pain am I looking to decrease, or what movement am I looking to make better. From there, you perform your manual therapy treatment. So if you're doing joint mobilizations, you do that according to the if you're going to do joint mobilizations, you do that according to your treatment prescription. If you're going to do soft tissue mobilization, you do that according to what you want to do as far as lengthening, treating, decreasing the sensitivity of the muscle. From there, what you then have to do is make sure you take a reassessment, because that is the biggest component of this. We have to make sure we're making a change. So if we're just putting our hands on somebody, that's very nice. But we have to make sure that we're doing something that is helping our patients. So now we're taking that reassessment. Did we gain range of motion? Did we gain strength? Did we gain neuromuscular helping? Did we decrease their pain? Then, if we did make gains, we have to do something to keep it. So my biggest mistake I see a lot of new grads, and let's be honest, I made to start, is you stretch them. You do manual therapy, and great, I've made gains. Look at this range of motion that's improved. You let them go home. Good for me. Pat yourself on the back. Look at this, what I'm doing for this patient. They come back and you're like, oh, your range of motion, your pain's back. Oh, well, let's do manual therapy again. Again, now you're in this cycle. You're not doing anything to change that. So that's where your therapeutic exercises become important. So you need to make sure you're strengthening that end range. You need to make sure you're doing something stretching-wise to keep that range or keep that pain down. We can't get into this cycle as a profession of you come in, you do manual therapy, and you say hasta luego. So the biggest thing I'll have when patients come in and be like, well, my doctor only wants you to do manual therapy. Nope, sorry, I'm not a manual therapist, I'm a physical therapist. Manual therapy is a tool that I have, and it's a tool that I use, and I think it's a great tool to have, but you have to make sure you're doing something for that patient on the back end, because otherwise they're just gonna be in this cycle, you're gonna keep seeing them, and trust me, I'm a person that people don't wanna see for a long amount of time.